didn't really have like one inciting incident that said, this is why I'm going to be a doctor. I just, from a pretty young age, probably grade school, knew that I had an interest in it and wanted to do that. What type of doctor I wanted to be has changed quite a bit from when I was a young kid to now. Originally started out thinking I wanted to be some sort of surgeon. And in undergrad, I had worked in a research lab in renal physiology and essentially met my mentor and was amazing. And so we did all this research, basic research on the physiology of the inside of the kidney, essentially. And that really spurred my interest. There definitely is increasing chronic kidney disease, dialysis patients. And I think part of that is patients living longer, more people living with diabetes and hypertension for longer periods of time. We're doing procedures that keep people alive longer, and so some of these cardiovascular procedures, patients would have never been alive to the point they are now, and so we're just seeing more and more people that used to probably pass away at a much earlier age are living and living well with some diseases that would have not allowed you to do so in the past. There are, especially our new patients, many of them are coming to us just hearing that they have kidney disease and have never heard this concept or know what it means or what's going to happen in the future. So yeah, I would use the word fear for some or nervousness. So I think a lot of ours is kind of settling down that fear and nervousness and say, all right, many people live with kidney disease for 50 years. And as long as we're taking care of the reasons that you have kidney disease, you should be able to live even with these diseases. Further on that point though, sometimes patients are actually getting labeled with kidney disease that they actually don't have kidney disease. So really, one pinpointing is this actually something you have? And then if you have it, how are we going to handle it? Because like I said, many people live with kidney disease for a long period of time, and if we treat their diabetes and hypertension accordingly, it doesn't have to be a bad thing. That's very rewarding is you have a patient that feels horrible and you can make some tweaks and adjustments and get them into a much better place. It feels, for them a sense of accomplishment, but also us feeling that it's just nice to see patients do better when they're not in a good situation.